So firstly, of course, it was a long time ago. So I started studying medicine in 1975. And it's not a very exciting answer. I think back in the day, if you did reasonably well in your final year exams and you'd done a mixture of science and art subjects, then your choices were medicine or law. I was accepted into law at ANU and medicine in Melbourne, and chose medicine. I would love to be able to say I'd had a burning passion to be a doctor, but my father was a doctor, so I probably grew up being exposed to medical practice. But really, I think it was just one of the things that you do. Having started medicine, I quite enjoyed my studies. I enjoyed being a university student. I was a university student at a very lucky time when, of course, we were given tertiary education assistance funding, and that was great. I was successful in my studies, and when I finished medicine, I planned to be a physician and go into general medicine, and so I started that, but really didn't like some of the procedural aspects, and so I experimented with a few things. I taught anatomy for a little while. I did a little term in anaesthetics, and eventually settled on psychiatry, and so completed my psychiatry training in 1990. And I think the thing about psychiatry, which was very different then than it is now, was that it invited curiosity. It invited you to want to talk to other people about often very personal aspects of their life, and it invited that sort of more reflective practice. Psychiatry is always, particularly public psychiatry, is a team-based endeavour. Private psychiatry, of course, is very different. You're often one person on your own with another person, but public psychiatry is a very dynamic environment. It's quite often quite pressured, and you certainly see a range of presentations, and again, often see people at their most vulnerable times. Look, I have been incredibly fortunate. So again, more by accident than design, I started being a psychiatrist in the forensic setting, working in prisons and secure environments, working in courts. I think that was very much a learning experience. It exposed me to a lot. I then moved into the department, and again, I moved in to a role as deputy chief psychiatrist, but just by good fortune, a person had left, and I acted in the director role, and I was in the director of mental health role for often, with as well as some acting times, probably for about 6 or 7 years, and then subsequently in the chief psychiatrist role. So it's probably in that director role, I got to work as a bureaucrat and within government. And I was very fortunate. Minister Pike was responsible for health and mental health, but I also worked with John Thwaites, and Daniel Andrews was actually the parliamentary secretary for mental health back then. So that really exposed me to national policy as well as state policy and system-wide work. And then I worked for a little while as chief psychiatrist, and then more recently, I was able to head up a very large mental health program under Melbourne Health, and so that brought me into close contact with youth, adult and aged psychiatry, and the whole operational issue of mental health at a time when it was not receiving the funding that I believe it should, and at a time of growing pressure. So I can't say which was my favourite one. I think I've been incredibly fortunate and have learnt a lot and been exposed to some great people and great experiences during that time. Well, the first thing I think to say is that it was a great honour to be appointed to this role, and I think it was tremendous that this role was created. It has to be said it was created in the COVID context, so whether it will be ongoing is unknown. So COVID has changed many things in our lives, some more so than others. Clearly travel, but also home education and lots of things that people are going through in their lives. But it's also changed the health system. So the conversion to telehealth and video health, the increased use of digital platforms, I think have been pretty significant, and I think will endure beyond COVID. So I think there's some of that shaping. But I also think it's important to reflect that COVID came along at a particular time. The Productivity Commission had been working on a very large program or project about mental health reform in Victoria. We had a Royal Commission that is due to release their report now in February. So it's at a time when there is hopefully, I think, an appetite for reform. And if I can shape that reform, that would be tremendous. And I guess the big thing that has happened to mental health over the past 10 or 20 years has been both Commonwealth and states and territories funding bits into the community, but that has resulted in a system that is often fragmented, complex and confusing, often almost duplicates. And so if that reform could better, could result in a more navigable system that to the user of the system, it didn't really matter who was funding it, they were working well together, then in my view, that would be important. And the other big thing, I think, the fact that mental health funding has not kept pace with general health funding and has not kept pace with the population growth. So we've seen a real narrowing of services, enormous pressure on inpatient beds, and evidenced by things like long stays in the emergency department and people struggling to access particularly that urgent care. Well, I think you're right that it has improved a lot. I mean, we just last week we had Are You OK Day, Suicide Prevention Day, so people are talking a lot more. I think the stigma though persists because, in my view, we're not having a very honest conversation about some of the more severe manifestations of mental illness. So I think we're talking much more about a mild to moderate mental illness, people feeling anxious or feeling depressed or reaching out for help through things like Beyond Blue and others. But we're not really yet talking about the sort of disruption that can happen to people's lives when they experience severe mental illness. The more severe manifestations of mental illness are still, I think, poorly understood, poorly explained, and often negatively portrayed in the media, and we just have to keep working at that. It's perhaps trite to say, but I think it's people who experience mental illness and their families, and particularly the commitment and the dedication that many people who work in the mental health sector demonstrate, often against considerable odds in their workplace. So I think it's that the people who I've worked with that have inspired me the most. Well, look, the one that I've always, as I said, I've been very lucky, but I've also been very keen to say yes, so that when opportunities arise, say yes. When you're asked to come and give a talk to someone, say yes. And so I think that then exposes you to a whole raft of experiences, and that's really what we want to do, isn't it? We want to keep our minds open to different ideas, and but also to how you can make a contribution.